Hello and welcome back to another episode of the Health Talks. I'm Dr. Shahid Mohammed Abdelaziz and I'm the host of the podcast. In recognition of the World Ovarian Cancer Day on May 8th, we're shedding light on one of the more serious conditions affecting women and often diagnosed late, which is ovarian cancer. Ovarian cancer is often referred to as a silent disease with symptoms that can be subtle and easily missed. And that's exactly why awareness, early recognition, and timely care are so important. And to help us understand this topic better, I'm joined by Dr. Amal Hassan Abddelaziz, a consultant and head of the Obstetrics and Gynecology Department at Thumbay University Hospital in Ajman. She's also the program director of the Medical Internship Program and a clinical professor at Gulf Medical University. Dr. Amal, thank you very much for joining me today and welcome.
Thank you very much, Dr. Shahid, and thank you for raising awareness about this very important topic.
Thank you, Dr. Amal. Now, to start, from your experience, how aware are women about their reproductive health?
Well, there are certain aspects in reproductive health where the women are comfortable and aware of, like breast cancer awareness, cervical cancer awareness, maybe infertility. But when it comes to ovarian cancer, the awareness is quite poor, what we have noticed. In 2021, there has been a study of the ovarian cancer awareness among women in UAE, and it has been stated that only 12 to 49% of women were aware of symptoms, risk factors of ovarian cancer.
That's a very significantly low number.
Yes. Well, if you see that the media has focused so much on other cancers and the awareness is very high among breast cancer, for example, cervical cancer, but the light has been not shed enough on ovarian cancer.
And do you see that women often delay seeking gynecological help if they have any concern?
Yes, it's not uncommon for women to minimize their symptoms or attribute them to stress, irritable bowel, and they focus more on caring up for their families rather than prioritizing their own health. It's very, very common.
Right, that's unfortunate actually. And from your experience, what are the symptoms that you observed women usually ignore?
Very often, symptoms like bloating, feeling discomfort after food, change of bowel habits, even some menstrual irregularities are attributed to other causes rather than worrying about more sinister things. It is not infrequent to be really with for other causes, but they should not be ignored. Other things is like gaining more weight suddenly or losing a lot of weight without intention, feeling some swelling in the tummy. People always think, they have gained a little bit weight rather than
Exactly.
tumor growing or something, but they should get checked when they get such symptoms.
Thank you very much for highlighting those subtle but very significant symptoms, Dr. Amal. Now, Dr. Amal, can you briefly define what ovarian cancer is and how it exactly develops?
Ovarian cancer is a cancer that develops in the ovary or around it. So it's not only starting in the ovary, but it can start in the fallopian tube or the peritoneum, which is the lining of the abdominal cavity. And it is basically genetic changes that happen within the cells where they can start dividing irrationally and growing, either invading locally or within the pelvis, or sometimes making distant metastasis, disrupting the health and causing pressure symptoms, bleeding, and different things.
Right. And we've heard a lot, especially on the media, the silent disease being referred to ovarian cancer. Why is it called a silent disease?
Well, because when you discover ovarian cancer, most of the time it is quite late. You've mentioned earlier, the symptoms are very subtle.
Right.
And a lot of time they are attributed to gastrointestinal causes, conditions, rather than to ovarian cancer. And it's very frequent to be feeling full early, like early satiety, having less appetite. And then people don't think directly it might be related to the ovary, and they just dismiss the symptoms.
Right. And that kind of emphasizes the importance of routine checkup for women.
Of course, routine checkup is a chance to go through their symptoms, their daily habits with the doctor, find out if they have any risk factors arising or appearing, and going through the systems to find out any issues arising for the patient.
Right. Thank you very much, Dr. Amal. And from your experience, Dr. Amal, how common is ovarian cancer, especially in our region, in the Middle East and the Gulf?
Ovarian cancer is less common compared to other gynecological cancers. So it ranges between 6th to 7th cancer. It is 3.5% of all cancers. In 2022, there were 106 new cases of ovarian cancer diagnosed in the UAE and 60 deaths related to that. So it ranks between 6th and 7th, but it is 4th as common cause of mortality.
In the country?
In the country, yes.
And it's significantly rising. So we should be more aware of the numbers, right?
Yes, you should, of course. Yes.
And are there any risk factors that women should be aware of and watch out for when it comes to the risk of developing ovarian cancer?
There are risk factors. Aging is one risk factor, so it is more common among women above 50 and around the menopause.
Right.
But the most significant risk factor is having a personal or family history of breast cancer, ovarian cancer, colorectal cancer. And there are certain familial conditions that lead to having such cancers. So anyone with such history should seek advice and check regularly. Other causes would be endometriosis, infertility, those who did not have any children or who delayed childbearing for later time are at a higher risk. Obesity, smoking. But as mentioned before, the most significant risk factor is family or personal history of the breast or colorectal cancer.
And this emphasizes the need for screening, especially for women who have risk factor, like a hereditary risk factor, to go early, talk to their gynecologist, and be informed, at least from the very beginning, if they're at a higher risk or not.
Absolutely. When it comes to those who have familial cancers, they have to do the screening. Unfortunately, for those with average risk, screening is not recommended. So for women with familial cancer, those who have genetic mutations like BRCA1 and 2 or Lynch syndrome, those women have to follow up regularly with ultrasound, tumor markers to check for the appearance or progression of anything. And they do have chances also to do some preventative measures.
Right. And from your experience, when should they come like the woman with the risk factor of genetic aspect, when should they start seeing their gynecologist for this?
Depending on which mutation and the family history. For example, those who had family members having cancers in earlier ages, they should start early. In those carrying BRCA1 mutation, they should start from their 20s and 25 onwards to check, because they can have cancers early on in life. So from that time onwards, they should proceed with their regular follow-up.
Right. And Dr. Amal, can you please shed light on the warning signs, let's say, for ovarian cancer? If a woman experiences or sees those signs, when should she immediately come to the gynecologist?
Of course, the recurrent abdominal pain, bloating that wasn't there before, over a few days. It's not once off, but if it's recurring over a few days or weeks, again, loss of appetite, change in bowel habits. These are very, very important signs they should not ignore, and they should present immediately to check what is going on.
Right. And Dr. Amal, can you please outline to us how is ovarian cancer diagnosed? What are all the parameters that are usually done in the clinic?
So ovarian cancer can be diagnosed based on in two setups, let's see. Sometimes it is diagnosed as an incidental finding. The patient is coming for anything else. Management of endometriosis, and during surgery, biopsy shows it is ovarian cancer. That can happen at times. And then there are the patients who present with those symptoms. In that case, ultrasound will be done. We can do the tumor marker, specifically CA125. And if they're suspicious, we move on to more tests like CT scans, MRI, and then biopsy. And for cancer, if we are suspecting cancer, it will be mostly excision biopsy, like removing the suspected tumor.
Okay, and once you diagnose a patient with ovarian cancer, how treatable is it?
Stage 4 stage ovarian cancer is comparable to other cancers. So early stage is stage 1, has very good prognosis if we manage to remove the whole tumor. The problem arises because a lot of times people present very late when it comes to ovarian cancer.
Yeah.
In that case, the prognosis becomes poor.
That's unfortunate, yes.
The prognosis also depends on the type of tumor, the grade, the biology of the tumor. So there are many factors there, but the earlier it is discovered, the better the prognosis.
Right. So this again emphasizes the same point of screening, following up with your doctor regularly. From your experience and knowledge as well, what are the common regular tests that women can do to make sure that their overall reproductive health is normal?
Say, normally people should present for their pap smear, for example, for the cervical cancer screening. And this is a chance for us to check them in general. People who have abnormal menstrual cycle, again, hormones are checked, ultrasound is done. This is, again, another chance to do an ultrasound and check if there's any abnormality. So as we said before, for average risk patients, we do not have a screening protocol for ovarian cancer per se, but the regular visits to their doctors for the other screenings will help them be caught early if there's anything. And at that time, it's a very good chance to discuss symptoms, anything that arises where they don't notice, but the doctor will know that something is off.
Right. Like counseling, talking to the doctor, telling them about any changes, I think that would definitely help to pick up the symptoms very early. And does the treatment always involve surgery, or do you have any other options?
Most of the patients will need surgery, but chemotherapy is also needed. It depends on the case. Sometimes chemotherapy is given prior to surgery to make the tumor more operable, and then an operation is done. Most people, for ovarian cancer, most people will need surgery, but it depends whether they will do it first on the first presentation or they'll take chemotherapy prior to doing the surgery.
So it's all subject to the staging of the tumor.
Yes.
Exactly. Okay. Doctor, now ovarian cancer is treated, a surgery is done, or a chemotherapy. What's the prognosis after treatment? Is there hope for fully carrying on a normal life after that, or is there a risk of recurrence?
As we said before, there is a risk of recurrence. But it depends on when we caught it.
Right.
A lot of people who have very early stages of cancer do very well. They have excellent survival, but they need follow-up. So once someone has an ovarian cancer, and we said before, ovarian cancer does not only start in the ovary, it starts in the fallopian tube and in the peritoneum. So such patients will need follow-up afterwards. But a lot in early stages do very well and have long remission. Later stages, the survival again is acceptable if we are able to remove most of the bulk of the big part of the bulk of the tumor, or at least we leave very little behind. And with chemotherapy, they do very well.
Right. And can you give listeners some advice into ways of how can they reduce their risk of ovarian cancer or cancer in general?
So many things we can do in general. It does not guarantee that we don't get it, but we reduce our risk.
Right.
For example, to avoid obesity. That is one thing. Avoid smoking, have an active lifestyle, and having regular checkups. That is very important to health. So I would say these are the main things.
Right. To carry on a healthy life, let's say, because obesity and smoking, they're like the epidemic of the century.
Yes, and it is associated with increased risk of so many cancers, not only ovarian.
And Doctor, you work at Thumbay University Hospital in Ajman, a leading healthcare facility. How do you help women at your hospital to screen for suspicious conditions, for example, or if you're concerned about something? How do you help your patients?
So in Thumbay University Hospital, we don't have a lot of facilities. So we start with the history taking, as we said before, from the history, we can find out the risk factors. In clinical examination, we proceed with ultrasound scan in the clinic. We do have a radiology center where we can have every possible MRI or CT as needed. And our laboratory will offer us, again, CA-125, other tumor markers as required. And interdisciplinary care is there for different types of problems that the woman may encounter, whether it's only gynecological cancers or something else. And we do have our chemotherapy. We have oncology, and we can offer chemotherapy for those and the follow-up for patients who have been diagnosed with cancers.
That's amazing, and doesn't leave anyone with an excuse to come in for their checkup. Whom would you encourage come in for the checkup as soon as possible?
Again, look into the family history. Anyone with family history of cancers should really come early for checkups and find out what is going on. And they should be more aware about the symptoms. People with endometriosis should have regular checkup because, again, endometriosis on its own is not uncommon, is a risk factor for ovarian cancer. So those people should be following up regularly for these symptoms.
Right. Thank you very much for your very informative discussion, Dr. Amal, and for helping us raise awareness on this significant topic.
Thank you so much.
It was lovely having you.
Thank you. Lovely being here.
Thank you very much to our listeners. See you in the next podcast episode.